Welcome to the Health Daily Show, your go-to where leaders, founders, and investors share insights on growth, innovation, and business building. I'm Chitra Nabat, your host. Joining us today is Kelly Bliss, Teladoc, President, U.S. Group Health. Kelly, welcome. Thank you for joining us.
Thank you for having me.
Kelly, we've been fortunate over the past year to have your CEO, Jason Gorevic, and Chief Medical Officer, Dr. Vidya Raman-Tangela, on the show. We've talked about Teladoc being the largest global provider of virtual health services, your approach to whole person health, expanding into primary care with P360, the saturation and commoditization in the telehealth industry that you're in. What's the progress on the top three areas in the growth agenda?
Well, those are big, gnarly areas, aren't they? So I appreciate you spending so much time with Teladoc Health. We're really proud of the work that we're doing across multiple dimensions. You named just a few. We're really focused on balanced growth. I would say that we're in a place now where top line and bottom line matter most. We're really fortunate to have a strong balance sheet of over $950 million in free cash flow. We're generating more cash than we're spending, which is always a great position to be in because that allows us to put more money in the business. We've been investing over $400 million in R&D over the course of the last year, and we'll continue to do that. We're really hyper-focused on where are the efficiencies, not only in our own operation, but on behalf of our members and our clients. And so we're really excited about what 2024 brings for us.
And take us into some of those growth areas, some of those continued investment in growth areas.
So many of those growth areas, as you can appreciate, are, as you mentioned, primary care. We're really bullish about where that's going to show up and how we're going to deploy new models of whole person care. We've been really hyper-focused on the member experience and exactly how that journey, how that member's journey continues through the various clinical use cases. We're, of course, using multiple instances of AI to help us really improve that member experience. So many growth areas that I'm really excited about in 2024.
Some of these dimensions, though, seem to not be yet reflected in the stock price, which has sunk more than 30% over the past year. What do you think is the disconnect and how to bridge that gap?
We focus on both top line and bottom line, as I mentioned, and we're really hyper-focused on where our opportunities are to improve the value that we offer to our customers. It's not, I think everybody here at this health conference appreciates that with the macroeconomic challenges, that it's really difficult for some of our stakeholders, and we need to be bringing value and showing up in a way that improves their outcomes. And that might be ROI, that might be patient safety, that might be access to a whole person, a single front door to the healthcare experience. So it shows up in many different ways. Those are the areas that we're focused on.
On the opportunities front, let's talk about some recent Teladoc research, which is saying that more than 75% of employers plan to increase their spending on virtual care over the next 3 years, and more than half will consolidate virtual care providers to those who are more comprehensive. Mm-hmm. Now, employers can plan. How do you actually get these folks to take action and capitalize on it?
What we've seen is you just deliver. I think it's as simple as that. We show value to our clients, and they're really starting to turn the corner around multi-product. You mentioned 75% of our sales this year have been in multi-product, 2 or more products. So what that tells us is clients are really understanding not just the value of an integrated offering whereby we're bringing forth all of the solutions together into a single front door and then allowing that member to navigate to the different rooms in the house. What we're doing is we're seeing that our clients are realizing the benefits on the back end. They too have pressures in their own organizations to optimize their employee base, their HR teams, and their health plan teams. And so they're seeing the value across both the product set, but also inclusive of just the cost of having multiple vendor point solutions. So when we show up and we can actually show that when you start to combine these member experiences driven by the clinical interface, so the clinician says, you were recently diagnosed with something and diabetes, for example, and we're going to immediately introduce mental health resources to you. We're starting to see outcomes that are significantly better than in cases where those are not the case, where it's only single point solutions. So we're seeing half a percentage improvement in A1C, a percentage point in systolic blood pressure, and we're starting to see weight loss, some more meaningful weight loss when we introduce mental health services.
You talk about weight loss. Teladoc, you launched a new program around weight loss in the past few months, which sells to employers.
Right.
The focus of the program is to help employers save money by better managing GLP-1 drug utilization, which is becoming a super hot topic right now.
Mm-hmm.
These drugs cost $500 to $600 per month forever if you have insurance, or $1,200 out of pocket. What's the forecasted traction in terms of how you're going to help employers save money, and how?
So what's fascinating is four out of five of our clients say that they believe virtual care can help them in this category. And so we're really excited about it. We know that this new class of drugs is actually having a meaningful impact on weight management and improving the cardiometabolic conditions, inclusive of diabetes prevention. And so when we are in a space where we know that deploying GLP-1s could impact clinical outcomes, which is great, we also know it needs to be in concert with nutrition and food logging and coaching and sleep, and have a more of an integrated lifestyle behavior change in order for us to sustain that weight loss and those clinical improvements over time. So what we're doing is we're working on behalf of our clients, both educating them on having that balanced approach to deploying what are arguably expensive drugs, as you pointed out. How do you deploy those such that it isn't a lifetime on those medications, but you're still leaning into the innovation of a GLP-1 in this new class of drugs, and allowing that to really help your members improve clinical outcomes?
You talked about member experience and whole person health, clinical integration. How do you continue to innovate and accelerate patient consumer acquisition, engagement, retention? Because that's ultimately what it's about, and trying to minimize churn.
Absolutely. What we do is we focus on what we call a hyper-personalized member experience. And so that is, we're curating an experience that is very dynamic based on my needs, my preferences, and we're building that experience. My experience will be very different from your experience based on my health, my profile, the way in which I want to interact with the healthcare system. And so when my experience, I have new content teed up for me that is different from you. We're on the back end tracking things like dynamic eligibility and what programs I have access to versus you. And I make sure that my clinical team is aware of those programs and can tee them up appropriately. And so we create that experience on behalf of our members, which we know at the end of the day, it needs to drive outcomes. And so the purpose of this integrated whole person care view is to continue to drive improved outcomes for our clients and our members.
Teladoc is using more than 60 artificial intelligence models. Bring to life for us how you're using AI on the revenue acceleration, revenue growth side, as well as the cost management, margin expansion side.
Right. So we're doing it a couple of different ways. We're certainly, as a part of our product itself, and making sure, as I mentioned, the hyper-personalization, we're providing nudges to the member to make sure that they're taking the next best action. On the back end, we're using it for our clinicians to make sure that there's clarity around navigation to the next action, and that clinician is aware. We're also using it in our member services model to optimize staffing and making sure that we're managing the staffing. It's a very complicated environment you can appreciate with 83 million members. Navigating those members to the right service at the right time efficiently and effectively. We're using AI in those ways. And so, and of course on the back end, we're also using AI to make sure that we're doing population management and targeting our contract performance and making sure that we're leaving no stone unturned in terms of our clients and bringing value.
Leadership. In career business life, there are many rules, codes, norms to how things are done. Where have you been a code breaker, and how did you do it?
It's interesting. I feel like I have always been a code breaker across a couple of different dimensions, both at work and my home life and my career. I think, starting my career, actually, I have a degree in psychology. And so moving through my career, using that as a foundation, really bringing together sort of atypical teams that you might not always pair together to really optimize and create high performance teams has been sort of my thing throughout my career. And so that's really where I've sort of challenged the norms around the typical codes of business and bringing teams together that really perform.
Kelly, thank you so much for joining us.
Thanks so much for having me.